Hello, my name is David Slaughter. Thank you for the opportunity to testify on the importance of community water fluoridation. I support community water fluoridation, and I'm against the addition of a warning to the Austin water bill. I'm concerned that adding a warning to the water bill would cause unnecessary fear and confusion by implying that fluoridated water is not good for our community. I've been living in Austin for 10 and a half years. I practice in Northwest Austin. Some people question why they should trust dentists about fluoride. Just because we say it's safe isn't good enough. And I get that. But the reason that you should trust us is because we dedicated our life's work to the prevention and promotion of oral health, prevention of decay and protection of oral health. Prevention of dental decay is the best service that we can provide a patient. Organized dentistry bases its support for community water fluoridation on the best available science, which has been demonstrated for about 60 years. Optimally fluoridated water is a safe, beneficial, cost-effective public health measure preventing dental caries in both adults and children. While fluoridation benefits the entire Austin community, perhaps its best success is helping to prevent childhood dental decay, which is one of the most common childhood diseases. Maintaining good oral health is good for the whole body. Numerous recent scientific studies indicate associations between oral health and a variety of general health conditions, including diabetes and heart disease. The World Health Organization promotes the integration of oral health, and general health promotion has integrated oral health into its chronic disease prevention efforts. The U.S. Department of Health and Human Services included oral health among the leading health indicators selected to communicate high-priority health issues used to evaluate the nation's progress in promoting healthcare objectives outlined in Healthy People 2020. While there are a few dentists who may speak against fluoridation, the larger dental and medical communities, such as the American Dental Association, the American Medical Association, and the American Academy of Pediatrics, support community water fluoridation. As Dr. Wong has demonstrated earlier, there's an abundance of information out there to support the use of community water fluoridation. But what we're talking about really today is the warning on the fluoride. And as I said, I'm worried that it would bring unnecessary concerns. And we keep talking about the development of teeth, and that is a very important thing. And the formula, well, it's the jar of formula that tells you how to mix it, not the water. That's where your warning needs to be if that's your concern. Likewise, we do get our annual report that lists every single thing that can be in our water. There's a lot scarier things than fluoride in there. If we're going to have a big warning about fluoride, we need a warning about all of those other things as well. Thank you for the opportunity to speak today.
Thank you, Dr. Slaughter. Next speaker is Dr. Barry, I believe it's Roach? Sorry. Please correct my pronunciation.
Good afternoon. My name is Barry Rauch. Thank you for the opportunity to testify on the importance of community water fluoridation. I support community water fluoridation, and I am against the addition of a warning to the Austin utility bill. I have lived in Austin for 17 years and practiced orthodontics in the Arboretum and Westlake areas. I have also had the fortune of practicing orthodontics in Europe for 10 years as well. I am here as a concerned citizen and a dental professional. I am a current member of the Capillary Dental Society and have been serving on its board for the last 10 years. I am also a board member of the Capillary Dental Foundation, which was started several years ago. The mission of the Capillary Dental Foundation is to improve oral health through prevention, education, and access to care. One of the main reasons the foundation exists is to provide access to care in our 5-county area. Fluoridating our community's water supply is one of the greatest oral health benefits the city has provided to its citizens. I applaud the city and its council members. It is a well-documented fact that fluoridating a community water supply leads to a reduction in tooth decay, the most common chronic childhood disease. One of the main reasons children miss school is due to tooth pain and dental caries. The city is helping the access to care issue by enhancing the dental health of its children. Imagine if fluoridation was stopped. Dental disease would increase, more Austin area children would be in pain, more school would be missed, further impacting our education system, which is already under duress. The increased costs of added dental care would further the tax burden of our taxpayers as well. Research shows that every dollar invested in water fluoridation saves approximately $38 in unnecessary dental costs. Water fluoridation remains one of the most potent weapons in disease prevention. America has a 50-year history of community fluoridation and its positive benefits. Again, I commend the council members and your service to our community, and thank you for this opportunity to testify before you.
Thank you, sir. And the fifth and final speaker is Dr. Mark Peppard, I believe. Peppard, sorry.
I'm Dr. Mark Peppard. I am here as the incoming president of the Texas Academy of General Dentistry. I'm also a lifelong resident of Austin, Texas, born and raised here. The Texas Academy of General Dentistry represents 2,700 general practitioners across the state of Texas. It's the second largest organization of organized dentistry there is in the state. We're dedicated to the continuing dental education. We're dedicated to the higher level of dental education. I am myself a master in the academy as predicated by the parameters of the academy. I went to Stephen F. Austin High School. I graduated from St. Edward's University with several years of training also at the University of Texas. I have a degree in molecular biology. I'm a doctor of dental surgery, and I've been in clinical practice for 28 years. In 1972, September 1972, water fluoridation was voted in by the city of Austin Public. That was my first election as an 18-year-old in the city of Austin. I voted for water fluoridation because I knew it was proper and correct. That's when I didn't know what I was talking about. Today I do know what I'm talking about, and it is still proper and correct. Everything that you do as public servants is for the better of the good of all. Every single organization in the world that studies this has promoted the safety of fluoride, has recommended it be an integrate part of the public health service. And there's very limited number of research articles that are opponents to this. Until the science catches up with the opponents, we have to stay with the proponents. And the proponents are valid people. Masters of Public Health, PhDs, MDs, DDSs, every spectrum of education has looked at this. Not just some limited doofus at the CDC, but valid people, not only in the United States, but the European Pediatric Association, the Australian and New Zealand Dental Associations, all have codified and validated the science in their own countries. This is irrefutable, peer-reviewed, legitimate science in proportions that are profoundly overwhelming. The statement by the Academy of General Dentistry here is also in opposition to any warning because of the efficacy and safety of fluoride is beyond question, and to provide a warning label on the citizens of Austin water bills would only disseminate incorrect information and unnecessary fear throughout the community. We have plenty of avenues of education. All of it's legitimate. Let's give our citizens a little more credit. Thank you.
Thank you, Dr. Peppard. I think that was the first time the word doofus was used that wasn't directed at us. Thank you. There were a few more signed up in favor of water fluoridation who didn't get to speak, and those two are Kathy Blunk. Is that correct, Kathy? And Dr. Frank Bonasso. Those are all the citizens that signed up today. So, committee members, with that, I'll open it for either questions of staff, discussion. Councilmember Morrison.
Thank you. I wonder if I could ask a question of staff. Did you get a copy of what Ms. Olnick passed to us in terms of language? And I wondered if you might be able to comment on that, or maybe you're welcome to look at. We'll share up here. She was commenting on the difference in the language between the language in Journal of American Dental Association versus what's found on the City of Austin's website. And I guess the question I have is, did our language come, how was our language developed?
And actually, I'll say it's off the CDC statements in the website. For instance, on the CDC website, it says water fluoridation is safe, effective, and healthy. Water fluoride at a level optimal for oral health poses no known health risks for infants. However, some children may develop enamel fluorosis, a cosmetic condition. And then also in terms of the recommendations for dietary fluoride supplement and to discuss with your physician. Approved by the American Dental Association, American Academy of Pediatrics, and American Academy of Pediatric Dentistry, there is a chart on the fluoride ion level in drinking water and at different age groups, and if there is at different levels of fluoridation, what is recommended. This shows that if there's less than 0.3 parts per million levels of fluoride in the drinking water, at 6 months, the infants are recommended to have a supplement of 0.25 milligrams per day. And so if the infant is getting no fluoride in their supplement, then that would be equivalent to having less than that in the community fluoridation. So that's where that recommendation
So the language here is derived from,
yes,
but we wouldn't see
the recommendation.
Precisely. Okay. And I guess the other highlight, that's the language about the 6 months, what happens at 6 months. The other highlighted language was you can also alternate using tap water and non-fluoridated water for formula preparation. Is that something that is derived from CDC?
Yes, that is. Let's see. It's off the CDC statement. I believe that I can find you the exact language for that.
I can take your word for it if you're
Yeah.
confident that it
Yes, that's consistent with
the language. So I gather that we've massaged the language here in an attempt perhaps to make it more. I mean, I know that when I hear some of the stuff read off, it seems like not really very absorbable as information. So I'm wondering, I assume that the work that we did on the language was to make it more accessible to
make
people?
it more accessible, and also to make it clear, because sometimes these statements are misinterpreted. I mean, that we are not saying that community water fluoridation is unsafe. Mm-hmm. And sometimes, again, even with the statement that we published, it's been misquoted. Instead, the city of Austin recommends against fluoridation or says that it's, and so that's what we want to be very clear, that we're saying it's safe, effective, healthy, and also protects.
And I would add that we just want to make sure that you understand that we are not advocates of a warning at all. What we're saying is, should you choose to provide additional information, we can provide the information through additional, the information that we have posted on the website through additional avenues. But again, just as all the other supporters of fluoride, we are against a warning because we feel that it might lead or mislead the public on what our intentions are.
But to highlight one piece of your recommendations is to post information from the city's website at neighborhood centers and WIC stations. I presume, and this makes a lot of sense to me, I presume that's because the issue in our language is about infants and so you're looking at trying to specifically target where we at the city are going to be, where as a city government will be engaging with people with infants.
Yes, and we also provide we have a number of units of service that we provide. They're up to 500,000, so we have a lot of contact hours should we decide to go that route.
Okay, thank you.
Any other questions? Councilmember Riley.
Yeah, I just wanted to ask one more question about the bill inserts. We had a letter from Ms. Barazer from the water utility about their ability to do inserts. But if Dr. Wong, if you or Carlos has anything to add on this as well, I guess that what we've been discussing is making sure we've got comprehensive information available on the city's website. There's no reason not to provide current, complete information on the city's website. And then to make sure people know about that, than to have some link to that website provided in an insert. And help me understand that how we could do that, how we could provide information on an insert in a utility bill that would direct people to the website. I understand there are limits on our ability to do inserts, but I'm not clear on exactly what staff is suggesting that we could do about that.
I'm not sure that I understand the question. We would recommend that the language that we have on the website just be made available through the utility notice, and also we can post it at our neighborhood centers and WIC centers. I'm not sure if that answers your question.
I guess one example is we already do a drinking water quality report on an annual basis. So one possibility would be to because we know this is an issue that a significant number of people in Austin are interested in, then we could provide, we could help people who are interested in finding more information. But since we are providing more information on the city's website, we could easily guide them to our website through additional language on either the drinking water quality report or some other insert in utility bills. And I'm just trying to get staff's suggestion about how we could do that. Would your suggestion be to the extent that we want to make people aware of the information on the website, that we could provide information, we could let them know on the annual drinking water quality report? Is that staff's suggestion?
Councilmember, if I could address that. Bert Lumbretas, Assistant City Manager. Our thought was that the website, for folks that we serve in the community, particularly with some of these programs, website may not be the most feasible way to be able to provide the information to folks that utilize our services, particularly at some of our facilities. So the idea we came up with is we have it on the websites for folks that already can access that. But then another idea was we can provide that same information as in pretty much in the way it is already on the website. Take that information and put it as a part of the annual bill or as an insert in our utility billing that we do once a year. So again, not a warning, but just simply take the information that we already have available on the website for those folks that may not have the ability to access the website, but could get it through this other means of information. That was the idea behind it.
And that would be, would that be a part of the drinking water quality report, or would that be some other insert?
Yes, and I'll leave it up to Jane, but our idea was we can either put it on the annual report, or if we don't have the ability to do it there, to do it through some other means, because it's our understanding the water utility already does like 5 pieces of information that they put out, out of the 12-month cycle. So whatever opportunity we can do to incorporate that, we certainly want to do that. But I can leave that up to Jane.
Right now on our consumer confidence report, the drinking water quality report, it is pretty packed in front and back with what is required by the EPA. And the limitation in the bill insert is what's called 3-panel, which means when you take the paper, fold it in thirds, each of those become a panel. So we've got all 3 panels for that month covered by the Austin Water Utility. We have, as Bert said, reserved other billings, and if the EPA requires that we actually do a hard copy mail out of that consumer confidence report, then we are no longer restricted to just the 3 panels. We can add other pages. I went deaf. Other pages similar to the what was shared by Ms. Olnick, the Santa Clara Consumer Confident Report, where we could add more information to that report and include it in a mail out if we have to do a direct mail out separate from the bill insert. So we do have options. We can either take, with the information we have, I would think it would only take 1 panel out of a 3-panel for some month in the year. We may be able to use the month reserved for the Consumer Confidence Report, but we can also include it into the Consumer Confidence Report if we have to do a separate mail out. So we have options to put the information out there.
But what you're suggesting is that you take all the information that's currently on the website and you put that on the insert.
That was the idea we had, yes.
Any other questions or comments? Councilmember Morrison.
Does any of this require any specific council action?
I'll leave it up to the committee. Certainly, I think from our staff perspective, it would be helpful to make sure that the rest of the council is certainly, giving us that direction. I'll leave it up to you, but we certainly would highly recommend that the council at least be a part of the direction, if that's what the direction you want to go, or if you want to, take any additional steps.
Great.
All right. Any other questions or comments? Sorry, sir, the public comment section is over this evening. Appreciate you coming down. Councilmember Morrison, entertain a motion.
Obviously this has been a very engaged conversation, and I think that the staff recommendation makes a lot of sense to me in terms of trying to ensure that we get information out there in a general way, but also that we target venues where children, infants are going to be, or parents are going to be. And so I would like to make a motion that we adopt the staff recommendation. And I guess the way, I'm open to this, but based on what Mr. Lumbreras just said, that it would make sense that our recommendation either be a resolution from us, or if there's a way that staff could bring it to the council with recommendation, if this motion passed, recommendation by the committee. I guess that would be my druthers. It's probably more straightforward that way.
So I have a motion from Councilmember Morrison to accept staff recommendations with additional input, and to have Health and Human Services staff prepare an agenda item for full action by the entire council.
I'll second that motion.
Second by Councilmember Riley. Councilmember Riley.
I would just add that we've heard that even the health authorities recognize that this is an issue that needs to be revisited periodically, that standards are revisited at least every 6 years. I would suggest that it would make sense to have an ongoing presence online as we do now, and be prepared to update that as the science evolves, and to let people know about where they could find that information on the city's website. I recognize that not everybody has access to the website, but I think from the standpoint of having information that can be continually updated, consistent with the latest information, I think it makes sense for the city to do its best to get that current information out there and make that readily available to the public. So I hope that could be integrated into the staff recommendation. And really all that would require would be that when we do a mail out, we just make sure people know. We provide some link to the city's website so that people know that they can go there any time and find out the current information that we have on fluoridation.
And then I'll just emphasize the comment I made earlier about providing it in English and in Spanish on the website and in hard copy. All right, I have a motion and a second. Is there any other discussion? All those in favor, please say aye. Aye. Those opposed, that motion carries unanimously. And committee members, there being no other agenda items before the committee, without objection, we stand adjourned.